Welcome to Resilience Redefined. I'm your host, Michael Ostrolenk. This show is about building better humans, institutions, and systems. On the show, I'll be interviewing many different experts from across many different fields, including human optimization, health and fitness, team building, mind-body medicine. In the institutional space, we're looking at different institutions and how we can create new ones, new models and maps, including in medicine, in education, in intelligence community, in law enforcement, in the military, especially in the special operations community. Thanks for being here and enjoy the show. Today, I'm on nationally recognized best-selling author, educator, and one of the leading voices in integrative veterinary medicine. For more than 40 years, Dr. Judy has helped transform the way we think about animals' health by combining conventional veterinary care with nutrition, acupuncture, chiropractic care, food therapy, and other holistic approaches. Through her books, online education, extensive media presence, she has empowered countless pet parents to become informed advocates for their animals' health. Dr. Judy, thank you for joining us.
Thank you very much for having me. I'm very happy to be here.
As a dog lover, and when we had our dog, unfortunately, we lost her quite a few years ago. The approach we took, because she had various conditions, was very holistic. Acupuncturist, nutrition, but we actually had to work with individual practitioners. I didn't, unfortunately, at the time, have someone like a Dr. Judy who kind of put it all together in one place. And before we kind of jump into what your vision of what the model and map you've created in terms of more holistic care, talk to us about like what led you, first of all, to become a veterinarian, and then the path leading you to kind of have a more holistic understanding of pet health.
Thank you very much. I think that my love for animals comes from my mother. She grew up on a farm and she loves baby anything.
Aw.
So if there's a baby animal, she's like all in. And so my mother has been a huge influence. She was a school teacher for her entire career. She taught first graders. My mom's only 4'10", so she had to teach small people who were smaller than her. But but she's a reading specialist, and when her kids came into first grade, they would leave first grade reading on a fifth or sixth grade level. So
Nice.
yeah, she's very, very good at that, and has helped my 5-year-old granddaughter, who is now reading like a whiz. Kind of amazing. But we live on a farm, and when I was growing up, we did not live on a farm. We had one dog. Sometimes we had two dogs if my dad had a hunting dog and my mom had the house dog. And when I was going into junior high, my father got a job and we moved from New Jersey to Virginia, and my sister was so miserable going in, she was in junior high and didn't want to move. And he said, if you will stop complaining and we'll just get in the car and go, I will buy you a horse. She'd always wanted a horse. I don't know why. And he said, I will buy a horse if you will just get in the car. And so she said, I'm in. And we got our first horses when we moved to Virginia. And my mother enrolled us in 4-H because she said, we have horses. We don't know anything about them. What the heck are we doing? And so 4-H was sort of the jumping off point for me. We learned a lot. We had to do public speaking, which has, thank goodness, because now that has come back to serve me so well. Um, and we got into showing our horses, and we didn't have a lot of money. My parents bought me this broken down old pony that had belonged to a friend, and the only way he could be shown was if he was on medication to numb his pain. And he got to the point where he was so bad he couldn't be ridden anymore, and we just wanted to turn him out in the field, and he was too sore to even just be turned out in the field. So my riding instructor's daughter was a veterinarian from Canada, and she came home for the summer and she said, hey, I can do a surgery on your pony. We'll take the nerves out of his front feet so that he can't feel, and that he can't be ridden, but he can be turned out in the field with his pony buddies and live for a few more years. And I said, well, that sounds like a good plan. And my parents came up with the $600 for the surgery, and I got to help. And I, got to help with surgery. I did the aftercare and had my pony for a few more years just as a pasture buddy. And I thought it was the coolest thing ever. Like, I could change a little girl's life. I could change the life of an animal by doing something this cool. So there was no looking back from that point. I think I was in about ninth or 10th grade, and it was just, this is it. And
Cool.
So fast forward, went to vet school, and I went to vet school in the early 1980s in the Midwest. So I went to University of Illinois. So we are talking very traditional, and so I learned completely traditional medicine. That's all there was back then. And I was in practice for about 10 years and I absolutely hated it. Didn't like what I was doing. I probably should have quit. I'd done something else. I don't know. But God saw something different, and a flyer came across my desk in the mail when we used to get real mail. And it was for a chiropractic course, but I didn't know it was chiropractic. It just said veterinary orthopedic manipulation, help your patients heal faster. And I thought, well, that sounds good. I'll go take that course. So I signed up, paid a lot of money, went. And after I got there, I realized they were talking about chiropractic. And I went, oh, I don't know if I believe in this. I don't know if I want to do this. I already paid for it and I'm here. I'm doing this. And I went back and started using it. And it totally, totally changed the trajectory of my career. And I had a business partner that was part owner of he was the majority owner of the clinic I was practicing in. And so I started doing chiropractic, and then a couple years later, I learned acupuncture, and then I started studying food therapy and herbs and light therapy and color therapy, you name it. And we had been partners for about 10 years, and he came to me and he said, I don't know what this black magic and voodoo is that you're doing, but I don't think I believe in it, and I don't really want to be a part of it.
Wow.
And he owned the main clinic up the road. So I said, okay, well, I'll buy you out. Not a problem. And so then I became 100% owner of the clinic. Eventually, that became two clinics. And I went whole hog, fast forward into all the complementary therapies I could fit in my brain and really made a name for myself doing that. Then I started writing books and then I built my platform of naturally healthy pets because I realized that in practice, I could probably see 30 patients a day. Um, with my online platform, I can affect the lives of millions of pets and their owners per day. And that's just been huge for me because my whole platform is about education and empowerment. If we can empower the caretakers of these pets to understand what is being offered, what is being promoted, and what the best choices are for their own pet, then that's huge.
Yeah. So I'm curious.
So when we look at traditional, conventional, Western, whatever you want to term the medicine I was practicing, um, we are all about treating symptoms.
Mhm.
We're about putting out fires, and we sort of wait for everything to fall apart, and then we're like, "Oh, yeah, look, his arthritis is terrible on the X-rays." Like we don't look at it from the time they're little tiny puppies and kittens and say, what can I do to prevent that down the line? How can I feed them better? How can I avoid things that are going to contribute to chronic inflammation? And so because I was in practice for so long, almost 40 years, I saw multiple generations of pets that belonged to the same families. And so most people, once I started doing more of the complementary and integrated therapies, uh, people usually come to the holistic practitioner after they've exhausted all other resources. It's like, ah, my dog has cancer. I've already been to 4 different veterinarians. I've been to the specialist. Nobody can offer me anything else. Or he's had allergies his whole life. He's ripping out all of his hair. He's bright red. The only thing they can offer me is more immune suppressants and this really awful food. And, so we're kind of the last stop on the bus route. And I would treat these animals from a totally different perspective and look at them and say, well, one, how did we get to this point of disaster that's been going on for so long? And then how do we stop the train and then try to reverse the train? And so we were able to do that pretty effectively with most things that came to us. But then, the people would see how much difference that made. So when that pet would pass and then they'd get their next dog or cat or whatever, they'd come in and say, "Well, I don't want to get to that point. How do I change the paradigm? How do I shift and do something different?" So it was great when we got those people who were then on their second and third generation of animals because they would stay healthier longer. They wouldn't have those chronic inflammatory issues. They wouldn't have chronic allergies, IBD, cancers, all these. And sometimes you can do absolutely everything what we consider right, and still a cancer might show up at 5 years of age or something tragic, horrible happens. The same we see with people. I mean, why do children get horrible cancers? So sometimes, you know, we can't derail the train that was set out early on. But we were able to see, one, improved health, a lot less medication use, and two, increased longevity. So, we in the veterinary world have sort of accepted that large breed dogs, Great Danes, St. Bernards, Wolfhounds, they're going to live 7, 8 years, 9 if you do really well. And small breed dogs, okay, they're going to live 12, 13, 14 years because small breeds live longer. Well, in my practice, what we started seeing is our Great Danes and our German Shepherds and our St. Bernards were living to 16, and our small breed dogs were living to 19 and 20. And, my husband and I have done a ton of rescue work over the years. Our particular breed happens to be spaniels. So we rescue Cocker Spaniels, Cavalier King Charles Spaniels, English Toy Spaniels. We've had a lot of spaniels go through our house. Most of them come from either hoarding situations, puppy mill situations, or, owner situations where they didn't have the money to take care of them. They were, fed in poor quality food. And so we get these animals that are just a wreck when they come in. Everything's infected. They can't hear well. They've got infections. They can't see well. Their skin's terrible. They have bladder stones. They have heart disease, you name it. And we can turn these dogs around, and most of these rescue dogs that we bring in are living well into their late teens, 18, 19, even though they got off to a horrible start. And so some of these were not we used to say that we only wanted to bring in the seniors because nobody wants to adopt a senior dog with 6 things wrong with them. Meanwhile, my husband and I would look at those and go, "Perfect. That's the exact one we need in our house."
Well, God bless you for doing that. That's awesome. Those.
It's fun to see them turn around. It is so cool when you can take that animal and you can restore vision, or you can restore hearing, and you can get rid of all that inflammation and that nasty smelling skin, and improve their mobility. We have an old Cocker Spaniel right now who came to us mostly blind and mostly deaf. And he's lost one eye. The other eye, he has very little vision. He doesn't hear great, but his x-rays are horrible. We don't know his age. He was a stray. And on his x-rays, and he told the communicator he's 17. I kind of don't believe him. I think he's exaggerating, but he's an old guy. And his x-rays look terrible. And so you look at that and you go, this dog should be crippled. He should be on all kinds of anti-inflammatories and pain meds. Nope. He races around our backyard. He's got a ball with a big handle on it. It's called a Jolly Ball. It's his favorite toy in the world. He's the only dog that we have that likes it. But we can throw it anywhere in our backyard, and his little sniffer works so well that he goes on a grid pattern around the yard till he finds it, and then he runs back with it. His x-rays are terrible. He should be limping. He should be gimpy. He should be just sleeping all the time. No, he wants to run. He wants to play. And, I look at that and I say, well, that's because I have him on good food, good supplements. He's not on any medications to decrease that pain. It's just like, no, we just turned off the inflammatory response that he had. And we do all of this with natural therapies. And so my goal is that all pet owners can learn these things, and all pet owners can get away from that treadmill of chronic medications that cause so much damage, and instead look at how do we repair and rebuild. And the body is really incredibly capable of doing that.
It definitely is. And as humans, as animals, it's true for us as well, not just the
Yeah,
farm kinds.
exactly.
Yeah, and I want you to kind of do a deeper dive into some of the modalities that you've integrated into your approach. But before you do, I'd be curious, what have you learned about our culture, your particular field, the culture in which it's embedded in, and yourself as you've evolved over the last 40 years of doing this kind of work, from conventional to integrative?
What I've learned is that we need to throw everything up on its head and redo everything. Um, Unfortunately, big pharma and big food, so big pet food falls under big food because the two largest pet food manufacturers in the world are Mars, the candy company,
Anecdotally.
and Nestle Purina, another candy company. So they're the biggest ultra processed food manufacturers and the largest pet food manufacturers. So each of them sells about $23 billion worth of pet food a year.
Okay.
The next largest competitor is Hills, which is owned by Colgate Palmolive, and they're about 6 billion. So huge disparity.
Yeah.
And unfortunately, here in the US, Mars is also buying up veterinary clinics, our veterinary diagnostic labs, our veterinary imaging services, and they have a monopoly on the veterinary industry. Now, if you happen to make ultra processed pet food and you also happen to own the veterinary clinics, guess what you're going to prescribe for your patients to eat? The food that is made by the company who owns your clinic and pays your salary. And you don't really have a lot of choice in that. And so we're also seeing huge changes in what they call the standard of care because private equity, and so we see this in human medicine as well, private equity is buying up veterinary clinics. And so now they're corporately owned. And private equity's whole goal is money,
Max.
making money, maximizing the return to investors. And so, unfortunately, that weighs very heavily on the veterinary professionals, both the veterinarians, the technicians, the veterinary nurses, the assistants, all the staff. Because in order to make more money for private equity, you're going to shorten appointment times. And so the veterinarian has to see more pets in a shorter period of time. They have to increase the revenue. So they basically give them quotas. You have to do this many stool samples a month. You have to do this many Lyme vaccines a month. You have to do, this many dental cleanings a month. And the veterinarians who don't meet their quota get called on the carpet at the end of the month. And so it's very bad for morale for the veterinarians and the lay staff that supports them. And so the attrition rate for veterinarians and veterinary staff right now is really high. I've read somewhere the average length of time that somebody remains as a veterinarian right now is like 7 to 9 years. And so a lot of these new grads are coming out with $200,000 to $400,000 in educational debt. So you have $400,000 in educational debt. You can't afford to buy a house or a car. Maybe they're making $150,000 a year and they're promised this huge sign-on bonus, but then they're stuck working horrendous hours in bad conditions with not enough support staff, and it's just very bad for everyone's morale, and it's not good for our patients.
Are there, obviously, you as an example, what I'm about to say, but are there countervailing forces in the space that
I wish.
can conquer time?
I wish. So AVMA, the American Veterinary Medical Association, and AHA, the American Animal Hospital Association, they're not fighting back against it at all. They seem to kind of embraced the fact that because so much money pours in for continuing education, support at the vet schools, from big pharma and big food. And so if that's where your funding is coming from, let's all embrace it.
Yeah.
And it's not good. And it has changed a lot in the 42 years since I graduated from school. Um, when I was in school, we only had one company that was making prescription or therapeutic diets, and that was Hills. And now there are many, but Mars has Royal Canin, and then Purina has their own therapeutic diets. And I'm all for the research behind them. I'm all for wanting to design diets to support different diseases that our pets have, but I wish they'd use good ingredients.
Yeah.
It's like, well, if you're going to use the bottom of the barrel ingredients and make ultra processed food that has carcinogens in it and preservatives that are bad for our pets, and they have dyes and they have all kinds of things in them, it's like, well, why can't we teach veterinarians, because we don't teach this, why can't we teach veterinarians how to design therapeutic diets using real food?
Mm.
Why don't we go back to using whole foods for our animals, which is what they used to eat back in the 50s when they ate our table scraps and they kind of partnered with people. That's how dogs and cats and people all, that's how they got domesticated and came together. It was like, oh, here's people, they have scraps. We're animals. We need food. Hey, we're going to go to them. They can supply food. Except that now we supply really bad food. I wish we had it on our side.
Ask you, so there's nothing like that.
No, but I'm working my way up the chain to get to Robert Kennedy, RFK Jr., because he actually wanted to go to vet school,
How did he?
and he caved to the family pressure of, no, you got to go to law school. But he's a real animal guy, and he really wanted to go to vet school. So I'm making friends with people up the chain, in the hope. So Peter McCullough and I are now friends, and Robert Malone, and so I'm like, you know what? One of you guys is going to get me in. But
Mm.
I figured that RFK right now has a lot of fish to fry. And so I'm letting him fry all those fish for the first couple of years. And I'm like, all right, well, once we start getting the human food chain figured out, then we can start making inroads into animal food chain. And really, it's going through FDA. And unfortunately, FDA does not enforce the laws that are on the books. So one of the laws that is on the books says that animals that die otherwise than by slaughter are illegal to use in food, including pet food. So if a cow is slaughtered for human food, okay, that can be used in food. But if a cow dies out in the field, we can't send that to be slaughtered for human food. We don't know what it died from. It might have been rotting in the field for a couple days, but and it's illegal for it to go to pet food, but it does go to pet food. And so, any animals that just, food animals that died, pigs, cows, okay, so let's look at avian influenza.
Mm.
All those birds that are being slaughtered with avian influenza, they're going to pet food. They're not going to landfills. It
Wow.
goes to pet food. And, the thinking behind it is, well, it's rendered. So it goes in a rendering vat and it's cooked at high temperatures. So any diseases that are in there are going to be killed during that high heat process. So when we have gone to us consumer advocates, when we have gone to FDA and said, well, it's illegal. On the books, it says that those animals are not allowed to be used for food. Why do you allow it? We consider it to be non-actionable. We don't think this is a problem. It's being cooked.
Okay.
So it's sort of like you get to pick and choose what law you follow and what you don't. It is disturbing. And the head of the largest rendering facility in the country was the keynote speaker at one of our national animal feed control officials meetings. And in that keynote, he said it is virtually impossible to have a rendered meat meal that does not have euthanasia solution in it. Because some of those animals that died that didn't go to slaughter were euthanized. And they're not supposed to go into that rendering vat, but oopsie, they sneak in there. And so back in the 1990s, FDA actually published many times, like, oh, we're seeing that, we tested, there's a lot of euthanasia solution in pet food. This is a problem for veterinarians because when we go to euthanize animals, the euthanasia solution doesn't work because their liver has actually learned how to make the enzymes to process it because they've been eating it. It's not as bad as it used to be, but there have been recalls within the past 5 years with euthanasia euthanasia solution in pet food, so pentabarb. And there have been statements made by FDA within the past 5 years saying, oh, yeah, we detected some euthanasia solution in X brand of pet food. We don't consider it actionable. We don't think it's a high enough amount to cause a problem. I don't know. To me, any amount, that's kind of a problem.
Problem. Yeah. Yeah. Maybe some of the laws are not useful.
Or just change them.
Or change them.
They could rewrite it.
Exactly. The two doctors you mentioned that hopefully will open some doors for you for Kennedy had questions about human vaccines. Do you have any similar questions when it comes to animal vaccines?
Oh, yeah. So, and actually, we're having a huge event put on by Naturally Healthy Pets in Dallas next year, and Peter McCullough is going to be one of the speakers.
Oh, fun.
And he's speaking about messenger RNA vaccines being used in both people and animals. So, now that we've had this huge, like, oh, look how much money we made making messenger RNA vaccines for people, we can make just as much money on pets because, we've got like 180 million cats and dogs in this country. That's a lot of money to be made. And so Merck has come out with messenger RNA rabies vaccines, influenza vaccines, and a feline leukemia vaccine. I wouldn't touch them with a 10-foot pole. They haven't been well enough investigated. They say that I did a social media post about this and said that, I think these are dangerous. We don't have enough information on them. And the AVMA actually, somebody sent it to them. They got a hold of it. They sent a newsletter out to all 60,000 veterinarians in this country with a link to that video saying that I'm an anti-vaxxer, which I've never said I'm an anti-vaxxer, but I am certainly we need to be looking at things. So I was like, well, yay, they just made me famous with all 60,000 veterinarians in this country. I guess that's good. I don't know. But, if it opens somebody's eyes to ask questions,
Exactly.
then yay, I'll be your scapegoat. No problem.
Yeah, exactly. And speaking of that, let me go back to the questions I asked, like the change of culture from conventional to present day. Your particular integrated approach, is there countervailing forces? It doesn't sound like there's maybe pockets of people like you who are very thoughtful and well researched and like questioning the dominant paradigm. For you personally, what did you learn literally about yourself as you evolved your thinking over time?
Well, I was brought up in a very, very traditional household. We never would have looked at anything alternative. Remember when I was in 5th grade, I was ranting about something, some teacher made me mad, and my grandmother picked me up from school and she said, you need to take an aspirin so you'll calm down. And I remember thinking at 10 years old, like, what's an aspirin got to do with calming down? I thought that was for pain. Uh, but that was, my family was, if somebody in a white coat said, "This is what you should do," then that was the gospel. Um, that grandmother and her husband both died of cancer at different times, and we weren't allowed to say the word cancer. They didn't wanna know that they had cancer, so we had to dance around it and never say the word, and I actually had a conversation with my grandmother's doctor, and the doctor was really peeved. It was because my dad and my uncle said, you need to go talk to the doctor about what she's got, her diagnosis, prognosis, blah, 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 because you're the only one who will understand what he's talking about. I'm like, okay, fine. So they made the doctor talk to me, and then he was so mad that he had to talk to a veterinarian, because a veterinarian is not a real doctor if you're an MD. Talk about, anyway. So he went and yelled at my grandmother for having to speak to me. And she didn't speak to me for weeks because, one, she didn't want to hear the word cancer. She didn't want to know she had cancer. And two, was not to intervene. And I was like, okay, I was forced, but whatever. But so my family has always been very, if the doctor says it, you do it. And as a matter of fact, my sister, with the whole, I don't know if we're even allowed to say, but with the whole 2020 debacle that happened in this country, my sister is totally on the opposite side of the fence as I am with that, which makes it really interesting because my mother lives with me and none of us got vaccinated in our household. And I'm very against it, and I never would. I don't think that mRNA vaccines are anything that we should ever get near. My sister, on the other hand, has had every booster available. So just, it's a total difference in how we see things. And I if I hadn't become a holistic veterinarian, would I have looked at that whole scenario differently? And maybe I would have. My first husband was a veterinarian, but he worked in public health. And so he is very pro vaccine, very pro, everything that comes down the pike. And it's our children are grown now, but it has made it interesting with those discussions on, should the teenager get the Gardasil vaccine? For me, I'm like, heck no. But the guy who works in public health is like, heck yeah. So, you know, if I hadn't gone down this road, would I have been? I mean, I had a lot of influences telling me to not be on this side of the fence.
Yeah.
Um, and even the whole pet food thing, I never, I was all in for prescription diets and ultra processed food, formulated by veterinarians. I was all in my first 10 years in practice. And now, oh my gosh, I just want to go back and apologize to all those animals that I sold all that stuff to. Um, so yeah, I mean, getting into this has totally changed how I look at new medications, new drugs, new miracle cures. It's like, maybe we should see what this does for 5 years. It got to the point where the drug reps hated coming in my office because they're like, "I've got this new great, yeah, this is going to be, you're going to sell this to everybody." And I'm like, really? Come back in 5 years. I want to see how many side effects, how many dead animals we have in that trail. Then I'll talk. And if you don't have a trail of dead animals and maimed animals from side effects from your drug 5 years from now, then maybe we'll have a conversation. And I never thought about questioning before. My first 10 years in practice, this is funny. My second boss out of school used to work for a pharmaceutical company, and then he went out into practice. And so, of course, coming from that background, it was, oh yeah, the pharmaceutical companies are always right. No, they're not.
And I'll paraphrase, but your partner said, "I can't."
Yeah, exactly.
Is that less common today than it was maybe then? Are you finding more people, maybe not the associations, obviously, because they're bought into the present day paradigm, but are you finding more and more veterinarians who are maybe more open minded like you,
So
or these clients, customers who are like asking the right questions?
I'm finding more pet owners
I don't know.
are challenging their veterinarians, and maybe it's just because of the people that the millions of people that I deal with. But when I go on the veterinary pages on social media where only veterinarians are allowed in the group, they are very, very negative about the clients who are coming in and saying, I don't want to give that vaccine. I want to do a titer instead. I want to do a blood test to see whether they have immunity rather than just vaccinating them. Or I'm feeding my pet raw food, or I'm making my own food. The veterinarians really hate those people. It challenges them, and, and nobody listen, you spent 8 years in college,
Mhm.
you got that degree, you're wearing the white coat, you were sold one way only to do things. It's no fun when somebody comes in and says, "I don't like the way you do things, I'm doing it differently." Or so here's a good example. My breed of dogs happens to have a lot of heart problems. And so I've spent a lot of time with cardiologists.
Mm.
And I had a great cardiologist that I used for my practices when I was in New Jersey. And every time I would go to him or I would send a patient to get an echocardiogram, he would be Mr. Gloom and Doom. Oh, stage D, heart failure. He's only got 2 to 3 months to live. Oh, stage C, he's probably got only a year to live. But then he would always say, go back to Dr. Morgan, and whatever that stuff is that she tells you to do, go ahead and do it because her results seem to be pretty good. But if you're the owner of that dog and you're not my client, but you've read up and you go in and you say, okay, well, I've read that CoQ10 can be really helpful for heart health. I've read that omega 3s can be really helpful. And the client will list a bunch of things, and the cardiologist 9 times out, probably 99 times out of 100 will say, I haven't read any studies on that. There's no proof that it works. Don't even bother. And meanwhile, it's like, well, I can show you this. Do you want to see the studies? Because I can show you the studies.
Yeah, yeah, yeah.
So, like one of my dogs, my friend, the cardiologist said, "Oh, stage D, he's got 2 to 3 months to live." I said, "That's great, Mike. I'll text you. I'll let you know when he goes." And 24 months later, I was like, "So, Mike, I finally lost that dog that you gave me 2 months on. I'm really glad your crystal ball doesn't work."
Exactly. So your thinking has evolved, integrated with multiple different practices, and I do want to get a sense of like you mentioned some, but some of the other things that you've integrated into the work. But I'm curious, like, what have how has what you've how has what you do with your puppies and cats affected how you treat yourself and your own family and your understanding of your own health and well-being?
So, we when I retired from practice and we moved to North Carolina, which was because my daughter was having my first grandchild, and I said, "Oh, we're moving."
Oh,
So I sold my practices and we moved to North Carolina, and we bought 23 acres. And so we've been here about 6 years. And in that 6 years, we have totally changed how we do everything. But it's because I know so much about the food industry. Like, I'm so glad that RFK Jr. is exposing the ultra processed food problem that we have. We've always thought that we ate pretty healthy, except now we have our own egg chickens. We process our own meat chickens. We have cows and have raw dairy and make our own cheese and our own yogurt. We have an organic garden and we raise all of our own vegetables. We have fruit trees. So we are almost self contained at this
yeah, yeah,
point.
yeah.
And we feed not only ourselves, but we feed my daughter and my granddaughter. We feed my son and his fiance. We feed my ex husband, their father, and his new wife. We all live very close together and we're all close. And so, yeah, we have this really weird relationship where all the exes are friends with the new people. And yeah, it's just the way it is. Um, believe me, it's a much better way to be. But we raise the food for everybody. And now we're raising so much excess food that we're also taking fresh food to the food pantry, which I just discovered when I was doing my Facebook Live today and people were chatting about it, that most food pantries will not accept fresh food because they don't have any way to refrigerate or freeze or store food. And so what we do is we take it down a half hour before the food pantry opens. We know it's going to get taken immediately. They don't have to store it. It's not a problem. But I mean, how sad is that that if you are food insecure and you have to depend on someone else to supply your food, it has to be ultra processed food. That really stinks. So we're trying to change that paradigm as well. Um, and then to find doctors, like I said, my 89-year-old mom lives with us, to find doctors that won't just keep prescribing medications to us. We ended up getting a concierge doctor who's a naturopath. I'm like, no, I'll take 40 supplements a day. Don't make me take medication. My husband had a cancer scare almost 2 years ago, and we just looked at each other and said, no, we don't like the options that they're offering. We don't like surgery. We don't like radiation. No, we're not doing these things. And so we actually contacted a natural clinic in Mexico, had big conversations with them. We designed a protocol for him using natural therapies, and he's cancer free. Yay, exactly. So would I have done that 15, 20 years ago? No, I would have, I look at my grandparents and I'm like, well, the white coat said we had to do this, and this, and we did what was said. And I I didn't want to question. Well, my grandparents never would have done anything alternative. I could have given them a great protocol and they would have been like, no, we're not doing that. The doctor in the white coat said do this. Um, so yes, it has totally changed how we do things and for the better. And you know, I, yes, we jumped off the diving board into the deep end. Not everybody can go out and buy land and have raise cows and chickens, and I haven't gotten to raising pigs. They're really destructive on the land. I can have somebody else raise the pig. But even the food that the small amounts of food that we do buy, everything is from regenerative farms. Everything is humanely raised. Um, it's just even like cleaning our house. You can't use toxic chemicals when you clean your house and then expect to have a good outcome. Our pets concentrate all those dumb chemicals in the plugins and the air fresheners and the cleaning supplies. They super concentrate them. They have a shorter lifespan. They spend most of their time on the floor. And so when we look at dogs and we look for, like, if we were to test cats, dogs, and people in the same household for toxic chemicals, we find a certain load in the people. The dogs will be about 10 times that, and the cats will be about 20 to 25 times that. Cats super concentrate. So for people that want to live a more natural lifestyle, really think about what are you using in your household and in your yard, because we can't control everything in our environment, but let's clean up the things that we can control.
100% agree. When I work with my clients as a therapist coach, I'm not a doctor, but I will, they're interested human optimization, like, so they're exercising, they're sleeping well, they're eating well. And then I'll ask them about their cleaning supplies. And it's like, oh,
Yeah,
they're toxic and carcinogenic. Like, you're doing all this great work to clean yourself up, but then your environment is contributing to
exactly.
against your health. So I'm really glad that that's part of what you teach as well. That's so, so important.
Yeah.
Yeah. So two things that came from what you just shared. The drugs, are you against them or just want to limit their use towards zero if there's other alternatives one can use that
Limit. So most animals that would come to me if they were coming from another clinic, um, a lot of them would be on boatloads of medications. And so, we look at those and we go through them and say, okay, how can we decrease these, particularly if they're on immune suppressants? When you suppress the immune system, hello, your immune system is responsible for scavenging your body and cleaning up any cancer cells that are popping up, which, by the way, they're doing that every single day. We all have them in our body. And so your healthy immune system says, oh, get rid of that guy. When we turn off the immune system, there's nothing stopping that freight train from hitting a wall. So a lot of it is how do we readjust things? And we've learned so much just even in the last decade about the microbiome and how we keep destroying it. So how do we rebuild that? How do we repair that? How do we repair the leaky gut? How do we repair the microbiome? What herbs or food could I replace those medications with? So, when we're looking at these arthritic animals that are on, or people that are on non-steroidal anti-inflammatories as their pain medication, well, what could I look for in nature that could make a huge difference? So we'll get anything that's inflammatory out of the diet, and then we will look at herbs that we can add in. So turmeric is golden paste. It is huge for inflammation. It's also really good for catching some of those rogue cells that have gone offline. So there are just so many things that we can use. Uh, and I'm not an herbalist, but I've learned over the years a lot of different things that we can use. And so, when we have these animals with chronic allergies or chronic inflammatory gut issues, it's like, all right, well, we just have to heal the gut and, make it sound so simple. We just have to heal the gut and then repair the microbiome and then stop assaulting it, and everything will be fine. And we can get rid of those immune suppressant drugs, and we can get rid of a lot of the anti-inflammatory medications. Um, I would say that we were highly successful in getting animals either off medications or on very, very reduced medication schedules. Um, so much of it has to do with diet. It just getting I mean, for people too. And that's like, I'm probably healthier now as far as my gut health just my overall inflammatory markers in my body, probably better now than it's been in my entire life because we eat fresh, organic food. We don't put toxins in our body, and that's such a difference. And my stress level is nothing like it was when I was in practice. And I have employees now, but it was much more stressful with the employees in the vet clinics. Um, it's just that being a practicing veterinarian, I worked emergency medicine for 10 years as well. But being a practicing doctor, stress levels really, really high. You've got a lot of lives that you're responsible for. Um, so it's my life is much better now.
Very happy to hear that. You've mentioned food quite a few times, and I'm curious on what's the latest research, for instance, on a ketogenic diet for dogs with cancer or cancer in animals.
So there's some really great research on that, and some people do use keto diets, and I used it for a few clients. It can be difficult to get clients to stick with it because it's like 70% fat, and everybody gets really wigged out. Oh my gosh, fat causes pancreatitis. But there was a great group. Uh, they ran something called the Keto Pet Sanctuary down in Texas for years. And what they did is they adopted dogs from shelters with cancer diagnosis. And they brought these dogs into the sanctuary and they worked on everything. One, they gave them all a keto, so they put them all on a keto diet. If they had a tumor that was open and bleeding, needed to be removed, they would do that. They worked also on emotional and mental well-being, so the animals got playtime and they got snuggle time, and it was just amazing. But their cancer cure rate was very high. They had zero pancreatitis issues with the dogs, and it was because the diet was raw. So raw fats do not cause pancreatitis. Cooked fats become rancid and oxidize and do cause pancreatitis. So it was great research for a couple of reasons. One, it got rid of that old, fat is the only reason for getting pancreatitis. It's not cooked carbohydrates for our pets are a bigger problem. Um, so they busted some myths, but they had a pretty high cancer cure rate. I don't think there are very many veterinarians who use keto diets, uh, but if we are going to feed our pets correctly, cats are obligate carnivores. So we need to be feeding them like little metasauruses, not feeding them dry kibble filled with corn and soy. Um, and we don't have near as much cancer in cats as we do in dogs, which is kind of interesting, even though we feed most of them wrong. Um, so there are a lot of people, a lot more people now, and the fastest growing segment of the pet food world is raw feeding
Yeah,
and
seen it.
and gently cooked low carb.
Yep.
So people are getting away from the starch filled diets, and so we're feeding them more species appropriate diets when we move over to that. And I think it decreases our cancer rate. Like all of my dogs that are living to 17, 18, 19. I did have one who died at 17 with cancer, but we diagnosed his cancer at 15 and he didn't die from his cancer. He just lived with cancer, which there's a big difference between dying from cancer and living with cancer. And I mean, like I said, we all have cancer cells in our body. So basically we all live with it. Um, my goal with my patients was not, we don't want to go from traditional cancer therapy, which is slash, cut, kill, use chemicals to kill it. We don't want to turn that into herbal chemo where we're like, oh, I'm going to use this herb because it'll kill the cancer. What we want is a high quality of life. My goal was never to make the cancer die. My goal was to make the pet live happily without side effects from the cancer. So, like, my little guy had 5 tumors in his bladder, and my goal was just that it never caused an obstruction and that it didn't spread. And so we had a diet and herb protocol for him, and when his last ultrasound that I did, probably a year and a half into his protocol, the 5 tumors were down to 3 and they were small. And I said, "Well, I'm not trying to kill the cancer. I just didn't want it to spread and I didn't want it to cause an obstruction. So goal achieved." So it's not necessarily about getting in that mindset of I have to kill the cancer. Like, I don't know that we've killed all the cancer cells that my husband had. Maybe there's some rogue kids running around in there. Maybe they'll raise their head again at some point, and then we'll, get even more serious about what we're doing. But I'm happy with it.
Yeah, yeah, yeah. Yeah. I mentioned,
Man, there's so many things so chiropractic was always a big part of it too. Um, I took Reiki. I did up to second level. It was not my thing, and craniosacral work. A lot of doctors are very good at that, but you really have to quiet your mind to be able to do those therapies. And my mind is going everywhere. So that one's difficult for me. We use essential oils. Um, Man, I've used color therapy. We are now using a lot of red light therapy, cold laser. It didn't matter what. I had one client who came in one time and she pulled out of her bag these cards and they were raindrop crystals on the cards. And I said, "What are we doing with those?" And she said, "It's raindrop therapy." I went, "Okay, no problem. If it works for you, I'm in. You do your thing." We did some muscle testing, we did some dowsing. I dabbled a little bit of homeopathy. I dabbled in a lot of different things. I had my main modalities that worked very well for me and that I knew inside and out. And then anything else that anybody brought to me, one of the things that happens when you go over to the complementary side is you become very open-minded.
yeah.
Somebody comes in and says, "I'm using the color purple to change my dog's mood to whatever." Okay. If that works for you. My sister, even though she's very into getting every vaccine, she's very good at craniosacral therapy, Reiki, and T-touch. And so she used to come to my practice, yeah, every month or so and see clients and do work. And she came in one day and she went in my exam room and she went, "Oh, this will never do." And I said, "What will never do?" And I didn't have exam tables. I just got down on the floor with the animals all the time. And she went outside and she came back in with 4 rocks in her hands. I said, "What are you doing?" She said, "Your room isn't grounded. I have to ground the room." And she put a rock in each corner. And I said, "Works for me." And those rocks stayed there for many, many years. They ended up being toys for dogs, toys for children, and I guess they were grounding my room. So up into whatever.
Yeah. Well, it sounds like it's like you're open to two different things. One is, even if it's a placebo effect that helps the animal, just like it's a placebo effect that helps the human, cool. But I could imagine to you, if it's not placebo and it has an effect, as seemingly you're a very curious human being, what's the mechanism of action? Why does this thing actually work to affect the positive change in this animal system?
Yep. Well, one of the great things about animals, like when I first learned chiropractic, I was like, I don't know if I believe in this stuff or not. Well, the very first patient that came in was carried in and couldn't walk. And I said, "Well, I'm going to give this a try." And the dog got up and ran out the door. I went, "That was cool." Uh, but yeah, my aunt's dog, I had been treated. It tried to jump on the sofa, little tiny thing. Tried to jump on the sofa. It missed and head first into the arm of the sofa and screwed up its spine. And so it was very wobbly, could barely walk. And I was like, "Oh man, blew a disc, did something really bad." And so, of course, I treated it with steroids. And then the dog had a really bad reaction to the steroids. It developed stomach ulcers. It couldn't take the steroids anymore. And I didn't, but this is how silly we are. I didn't want to tell my aunt that I was doing chiropractic on animals. Remember, I came from this very traditional family. So I took her dog in the back room and I did a chiropractic adjustment on it, put the dog down on the ground, and it ran out the door and ran back to my aunt. And she went, "You cured my dog." And and I'm like, now I have to tell her what I did."
You do.
And she was like, "Well, why didn't you do that at the beginning?" I was like, "'Cause I thought you would think I was crazy." So, the great thing about animals is, either they're walking or they're not, they're limping or they're not. You do an acupuncture treatment on them and they get up and they're not limping anymore. You go, "Well, I don't think he's faking it." You know,
Yeah, yeah, yeah.
it's pretty cool.
Yeah. That's awesome.
I don't know. These things can go forever. So the big thing that I would say to people is question everything. When your vet says, "Here, give this neurotoxic pesticide to your dog to prevent them from ever getting fleas and ticks," that's a lie because the tick and the flea have to bite them in order to get the neurotoxin. And by the way, the neurotoxins may cause seizures and death in your own animal. Question everything. When you go to the pharmacy to get a medication, they give you like 3 pages of these are the side effects to watch for. It interacts with these other medications. When you go to the veterinarian, you get handed a bottle with some pills. Here, give these. Nobody ever tells you about the potential side effects. Nobody tells you about the drug interactions. You need to ask. And, if they tell you there's no side effects, that's a lie because you can die from drinking too much water. So we all carry mini computers with us. You need to look up the potential side effects. You need to ask questions. Um, and, whether it's a vaccine, a prescription diet, of medication, a therapy, whatever it is, ask questions.
I love that. That's great.
So where can people find out? You have books, you have classes. Where can people find all your great stuff?
We have a ton of stuff. We're on all social media. We're under Dr. Judy Morgan's Naturally Healthy Pets. The website is naturallyhealthypets.com. We have tons of free resources, free recipes, free downloads. We have courses on Dr. Judy U, just tons of stuff out there. I have my own podcast, Naturally Healthy Pets, which is on YouTube and all the usual channels. So for people who want to learn how to take better care of their pets, how to get them to live to be late teens, just check out all our stuff.
Definitely encourage people to do that.
Thank you very much for the opportunity.